hoping from all the dialogue I was seeing that we're both catching up with old friends and meeting some new ones, and having that opportunity to sort of connect and share with each other and understand where our opportunities are to build off of each other's work. So our panel today really reflects the recognition that USAID intentionally designed YouthPower with these two arms. One really focused around implementation and how implementation can inform future programming, and how evaluation is able to both amplify and understand what is working in that implementation. So the prior panel focused really around that designing and implementing PYD programs, and our discussion here today is really going to focus on how do we measure and evaluate PYD programs. And our panelists are going to focus on strategies when thinking about designing evaluations, thinking about how do we do positive youth development measurement, ensure that we are applying a gender-sensitive lens to that, as well as ensuring youth inclusion not just from a process side, but that we are looking at it from an outcome and impact side. So we're going to open the floor with a summary of some of the work that we've been doing in YouthPower Learning, looking at and understanding what works in positive youth development in low and middle income countries, and what is that impact. And so we did a systematic review recently focused on PYD programs in the LMICs, and I'm going to ask Jacinta Kapungu to provide a brief summary, and then our panelists, who I'll introduce once we get started, these researchers will really help share different insights that will build off of that. So, Jacinta, I'll give you a quick introduction. Jacinta Kapungu is one of our colleagues on YouthPower Learning. She's the Senior Gender and Youth Specialist at ICRW, and has really been one of our key team leaders within YouthPower Learning. She has over 15 years of experience as a clinical psychologist, community-based researcher, and program developer with a specialized expertise in adolescent health, sexual reproductive health, mental health, and HIV/AIDS. So, Jacinta, welcome.
Good morning, everyone. How are you doing? Okay. So what I'm going to do is I'm going to do a brief summary of the systematic review of positive youth development in low and middle income countries that was published this year, completed by YouthPower Learning. So we know from decades of work in high-income countries that positive youth development programs impact multiple outcomes across sectors. So in the research that has been done in high-income countries, we found that PYD programs have demonstrated impact by decreasing violence, delaying sexual activity, increasing academic soft skills, increasing community engagement, reducing substance abuse, and improving relationships. So earlier this year, we published a systematic review to answer two questions. One question was focused on implementation of PYD programs in low and middle income countries, and the other question focused on what is the evidence about the effectiveness of PYD programming. So we conducted a systematic review, which consisted of a systematic search of peer-reviewed literature and a purposive search of gray literature that was composed of program descriptions, case studies, evaluations, and project reports. Our criteria for inclusion into the systematic review was that projects had to engage youth between the ages of 10 to 29, and they had to include at least 2 PYD-related outcomes within the domains of assets, agency, enabling environment, and contribution. And these papers were published between 1990 and 2015. We actually started out with more than 21,000 papers, and through the systematic review search, we identified 108 reports, which consisted of 97 programs implemented across 60 countries that primarily covered 3 sectors: health, democracy and governance, and economic development and education. So what does the evidence say about PYD in low to middle income countries? Well, most of the PYD programs were really concentrated in South Africa, China, and India. Studies were across sectors, but mostly in health, and all but one focused on assets. We also found that most programs did not even self-identify themselves as positive youth development. So it was a new terminology. Most of the studies varied in quality of the evaluations, but the strong evaluations showed that PYD can be effective in low to middle income countries. So I'm going to talk a little bit about the sector-specific findings. So in the systematic review, there were about a third of the programs that were in workforce readiness and employability. All workforce readiness and employability programs identified through the review focused on assets, mainly building vocational competencies and soft skills. In terms of outcomes, we found that programs increased formal and self-employment. They had better quality of employment and financial assets. We also saw effects across other sectors, such as an increased voluntary contraceptive use, improved HIV and pregnancy, and also decreased child marriage, as well as improved community gender norms. Well, one of the challenges within the sector was that a lot of the evaluations weren't rigorously evaluated, and so that is a definitely evidence gap. Now, most of the programs were in the sector of HIV/AIDS and sexual, reproductive, and health. And some of the characteristics of effective programs consisted of the following. They were based on theory. They intervened at multiple levels, whether that was family, community, and peer. Programs provided accurate information about sexually transmitted infections and HIV and methods to prevent pregnancy. They provided specific skill-building activities, whether it was focused on increasing communication, increasing negotiation, higher-order thinking skills, and refusal skills. They also trained teachers, community members, peer leaders to implement the program in various modalities, whether that was videos, dramas, role plays. And they also addressed gender-related issues. And the main activities that we found within HIV/AIDS and SRH consisted of educational activities not led by peers, so mainly adult-led activities, and also some type of peer education. In terms of outcomes within HIV/AIDS and SRH, we found that boys and girls reported higher self-efficacy to use condoms with their partners. They reduced sexual risk behaviors, such as reducing number of partners. More youth were using condoms continuously. Fewer youth were having unprotected sex. We also saw adolescent girls report fewer incidents of unwilling sex, reduction of HIV-related stigma. More youth were using SRH services, and you also saw a reduction in teenage pregnancy. And as I said, PYD impacts cross-sector outcomes. And so through these programs, we also found that there was reductions in child marriage. Girls had higher school status. Youth were more experienced in working for pay or generating their own business. And you also saw better mental health outcomes, reductions in youth drug use, and also a high sense of solidarity and trust. Within the democracy, human rights, and governance programs, these programs really focused on building assets, which included life skills and education about SRH, violence prevention, and human rights. Democracy, human rights, and governance programs were also more likely than the average PYD program to emphasize youth contribution. So youth engagement was a component of these programs. They also utilized media programming, meetings, and social events. And some of the outcomes that we saw included political empowerment, increased agency, self-efficacy, and social skills. Also, decreased child marriage, as well as improved community gender norms were found in some studies. So overall, when we look at the systematic review findings, what were the key take-home messages? Well, first and foremost, we heard a lot from the youth today about the fact that youth should not be sidelined. They need to be active partners and engage in all phases of the program design and implementation. You also need to engage key community stakeholders, especially if you want to ensure that your program is relevant, culturally appropriate, and ensure sustainability. It's important that we intervene at multiple levels, that we really take a socio-ecological approach in looking at the individual, the family, and the peer, because the youth is not in isolation. They are within a larger context. The systematic review also showed that it was important to promote youth-led and youth-centered approaches. Unfortunately, only half of the programs really engaged youth. So this is something, an area that we need to focus on. And most effective programs did a better job of engaging youth. And we should also leverage existing evidence to improve the design of programs that target youth. There's a lot of evidence in high-income countries. So what are some promising approaches that we can translate to low-income countries? And how can we use this evidence base that we found to the systematic group to continue to advance and determine what works and what doesn't? In terms of opportunities to develop knowledge, the PYD measurement toolkit can inform a more robust PYD design by establishing longitudinal relationships between PYD concepts and positive and problem behavior outcomes. We also should ensure that we invest in developing new knowledge, understanding what works in different contexts, and what works for whom. In the systematic review, we found that not a lot of programs, well, none actually, focused on LGBTQI. We also needed programs that focused on other target populations, such as people with disability, pregnant girls, married girls as well. And so these are areas in where we need to really start developing some programming for these key populations. In the systematic review, only 43% of programs actually integrated gender. And we found that those programs who were effective did target gender-related issues. So we must really further gender integration to PYD programming. So how can we have a big impact? Well, the Usaid Youth Policy provides the foundation on PYD principles, and it provides guidance on what is needed to improve youth-focused programming. One thing from the systematic review is that we need to train staff on PYD for effective programming. We've been doing capacity building workshops with program implementers. We did one in India, we're about to do one in India. We did one in South Africa and Ghana. And our workshops did confirm that PYD is a new terminology. They referred to it as human capital development. And so it really is an opportunity to let people know what PYD is and let them know what the evidence says in high-income and low-income countries so that we can increase uptake. We need to support applied dissemination and implementation of research of these programs. And overall, positive youth development really has the potential to be an intermediary linkage to your sector-specific outcomes, and we can improve our development efforts if we include it within our programming. So overall, it has a real potential to assist in creating equitable global youth development. Thank you.
Great, thank you, Jacinta. For those of you who do want to get more information about the systematic review, we have a few select copies of the full review, but we do have several briefs that you could take with you that provide a quick summary, as well as if you're looking for a little swag and to decorate your office a bit, we have infographics that really outline what is positive youth development and what did we find from the systematic review. So there's some posters of it back there. Please take some home, decorate your office, your house, but help it serve as a reminder of what we have learned so far and what we still need to learn. And so with that, I would like to introduce Dr. Sajida Amin. She's from the Population Council, and she leads its work on livelihoods and adolescent girls. She's a senior sociologist and a demographer with decades of experience on generating the evidence on empowerment programs for girls and women. So welcome. Sajida, Population Council had conducted really the first rigorously evaluated cross-sectoral study that provided evidence about how life skill building approaches can effectively increase work for pay, can decrease the number of out-of-school girls, and focusing specifically on the age group between 12 and 18. And it was based in Bangladesh. Can you tell us a little bit more about the Balika study?
Wonderful to be here. So the Balika study is as Cassandra mentioned, focused on young girls in particular. Balika is a Bangla word which means young girl, and it's very intentionally designed. It spells out as some program that focuses on life skills, livelihoods, and income generation. We were fortunate to be approached by donor interested in the evidence part of it, and we were also fortunate that we were leading an intervention research initiative, a consortium, where we had a very central role in the design of the Balika interventions. The central objective of the intervention was to try and address child marriage in a setting that needs a little bit of background. Bangladesh has been sort of started as the world's basket case in terms of having all the worst development indicators. Over the last 20 or 30 years, it's come to a position where there's been great achievement in achieving universal education, replacement level fertility in most of the country, significant improvement in life expectancy. But child marriage remains, it has the dubious distinction of having some of the highest rates of child marriage under 15, the highest in the world, and ranks 4 in having early marriage globally. So the specific objective was to try and design a program that was multi-sectoral, and we decided to ask the question about whether a certain kind of skill development could affect child marriage, and we specifically designed an RCT, a randomized control trial, to ask which kind of skill development mattered. But in the process of implementation, we built in to the program implementation a number of other indicators which we thought were important, had been established in the field as being important factors affecting the success of programs. These included providing safe spaces, having a high degree of community engagement, and providing technology as a way of enticing girls to engage in the program. And the history of this is that Bangladesh has had, through various very large-scale NGO initiatives, lots and lots of programs that create safe spaces for girls, where girls come and sit with very bored faces because they've heard SRHR messages 1,000 times and they don't want to come back. This is also sort of a reflection of the dynamic community that we decided we were going to try and jazz it up a little bit with computers and technology and various kinds of new skills and ideas that the program would promise to give. We also decided, and this was sort of a practical decision, that we needed to put in a lot of effort to make sure that the program was close to the community, would eventually be taken up by the community, and the community would feel that it was their initiative. So we called it the Balika Center, the Center for the Girls to Come. It was close to the homes. It was situated usually within the primary school that catered to that community. And we had specific programs designed to bring in and get buy-in from community leadership, from parents, from the local boys and men. But the RCT component basically asked the question, which skills mattered? And I'm really happy, pleased, flattered that Balika was picked up in the PYD scans, and that it is recognized for what we were trying to do in terms of a fundamental approach in the program, which is to start with the understanding that a basic driver of child marriage in Bangladesh is girls are seen as liabilities, not assets. And the program is trying to promote the idea that sort of a transformative idea for the purpose of child marriage, which is to change that position within girls themselves through confidence building, etc., but also that perception about the girls in the community. Hence the strong engagement of sort of making everything about the program very visible. Now, in a Bangladeshi context, I'm from Bangladesh, I know what is also another fundamental driver of girls' isolation and disempowerment is the separation of the genders and the confinement of girls and women in a private sphere. So the fact that the program very deliberately tried to bring the girls out and in a safe and logical way to try and bring about that transformation was an important part.
You know, I think you had the ideal circumstance for building a rigorous evaluation because you were both co-designing the implementation as well as then doing the evaluation. And so that close relationship really helps lend itself to that design. What other recommendations do you have for designing an evaluation that looks at multiple measures and multiple outcomes?
So I think one of the challenges, and this is sort of 2020 hindsight, so I'm not sure I would have said this at the beginning of the program, but one of the realizations, epiphanies that I had after we saw that the results of the program was not just on child marriage, but on reducing dropouts, increasing wage work for women, improving the environment in terms of gender attitudes, etc. And I think, if I think back, it's this focus that we had in our understanding and our theory of change on addressing a driver. And then rather than saying sort of in what sequence does change work, is it education that changes child marriage, is it child marriage that changes education, we basically have a setting where we know that all of these outcomes are all related. So I think I would, the implication of that is I would focus from the outset to think about where your interventions fit in and how they relate to this, you know, everything is related to everything perspective, but in some way that is informative. The other thing I would say along the same lines, and to kind of promote more understanding about how change happens, is to have rigorous research design, but to have a longitudinal design so that, and with multiple points at which you see where the impact comes about. Because one of the frustrations we have with Balika now is that the project has ended. We have 2 points in time, and we really could have asked a lot more questions if we had multiple rounds of data through which we could kind of trace the pathways of change.
Theory of change and addressing what are those drivers to get to end outcomes. Sorry. Thinking about how you address drivers and the theory of change is really important. And then what are we measuring, right? So thinking about how do you think taking a stronger PYD approach in measurement, and so focusing on those types of indicators could help strengthen evaluations, as well as what do you wish you had had in sort of hindsight to have been able to collect that was more PYD focused?
So one of the things that we didn't focus on is mental health outcomes. And I think particularly thinking about how some of the areas in which we had impact, for instance, increased self-efficacy or changing gender norms, or even something very simple like reducing school dropout, how does that translate to other related outcomes like mental health, like you know, the sequence of education to marriage, for instance, what is the ordering of things that would have been.
Thank you. I want to go now to our next speaker, to Jeff Edmeades, who is a senior social demographer at the International Center for Research on Women. His research primarily focuses on the interaction between the development process and demographic behavior, and particularly looking around fertility, contraceptive use, and migration, as well as household-level decision-making, and the role that gender norms play in shaping our demographic outcomes. So, Jeff, ICRW had conducted a study called TESFA, Towards Economic and Sexual Reproductive Health Outcomes of Adolescent Girls. And it really sought to improve the lives of about 5,000 girls between the ages of 10 and 19 in Ethiopia. Could you tell us a little bit more about this particular study?
Sure, thank you, Cassandra. So this was implemented by CARE Ethiopia over a period of about 2.5 years. The project really was focused on trying to understand the interlinkages between programming that focused on sexual reproductive health outcomes and economic empowerment outcomes. Unlike a lot of other projects that focus a lot on adolescence and prevention of child marriage, we focus specifically on girls who had already been married. And this area of Ethiopia has traditionally had very high rates of child marriage. As many of you know, Ethiopia has really seen quite marked declines in rates of child marriage. But for these girls at this age, they were really on the tail end of the high prevalence period. And many of them, ironically, are divorced as well. That area of Ethiopia has very high rates of divorce as well as child marriage. So we included ever married girls, about 5,000 of them, in a program that was a group-based peer education approach, that with CARE developing the curriculum that focused on, one set of curricula that focused on SRH outcomes only, the other one that focused on economic empowerment outcomes using the village saving and loans approach that CARE has, and one that tried to combine those two, with the research question being, how does the combined approach work in terms of additional outcomes, and is there some sort of synergy between SRH and economic empowerment that we might be able to exploit and see greater improvements in overall well-being among these girls. So the girls met twice a month. They had their own peers, a nominated peer who received additional training, and then would train them with support of a community facilitator who would visit them probably every third to fourth meeting and catch up with how things were going. There was also a rigorous community engagement component to it. So community members also nominated a committee who would work more closely with the girls, and they received their own curriculum, which included a lot of gender transformative, gender challenging education components, as well as meeting regularly with the girls themselves and essentially facilitating the programmatic aspect in the community. So we, like Sajida with Balika, we had a baseline and endline approach. Girls were split into these arms, and so we were able to compare those who had just received one type of programming with another, and all of those against girls who were in a comparison group. It was quasi-experimental, mixed method approach, so we had both quantitative and qualitative approaches and outcomes. And I think of particular interest here is that as you're doing these sort of multi-outcome, more complex studies, you end up collecting a lot of information. So we needed to know both enough to evaluate the SRH side and enough to evaluate the economic side, and enough to understand whether we were shifting core drivers. And so there was a lot of information that was collected in various different ways about different components, and the interesting pieces there, I think, that emerged in terms of PYD in particular were the issues around communication, effective negotiation, so negotiation with families and with husbands, and that was, in many ways, this is what the girls themselves would tell you was their initial biggest take-home from the participation in the program, was having a framework to even have a conversation with their husband. And so when we were inquiring about levels of communication with their husband, how often do you talk to your husband about events that happen in the community? How often do you share your hopes or visions for the future with him? And there's a very significant proportion of these girls who essentially don't talk to their husbands about anything. And they're also the most vulnerable. They're out of school. They're not engaged in the health system in a meaningful way yet, typically. They're not tracked effectively by the government. They're not a focus of any programs that are trying to prevent child marriage because they've already been married. And so there's this gap in our knowledge about what the lives of these girls are like. And I think the TESFA program went a long way to helping us better understand their lives, as well as I think showing some very promising results particularly in terms of the sexual reproductive health outcomes, but then along the way illustrating the value of these intermediary soft outcomes that are just so critical to better well-being, and then in the longer run achieving these broader outcomes that we're looking for.
Thank you, Jeff. And you know, this study was done, what, in 2013 was it completed? So before we had even developed our PYD framework and thinking about it, but it's great to hear a reflection around what was being measured. And I'm wondering, you know, thinking about what Jacinta mentioned, where about half the programs incorporated a gender element to it, and those that did so quite successfully. What sort of advice would you have, or what approach or methods would you use to intentionally evaluate and measure gender-related issues? What would you recommend to our audience here?
Well, I think that there's some key gender pieces that we have to know, and those are essentially around the core areas that we probably already are looking at quite well. So in some cases, less so in Ethiopia than in other contexts, but you might want to know about physical mobility. You would need to know about decision-making. That's true across all aspects. How you measure decision-making, that's a more thorny question, but we need to understand the process. We need to know where and how engaged people are in that, and who are the actors in core decisions that are being made either for them or with them. I think issues around trying to understand the essentially power that these girls have over their ability to influence their lives is essential. And getting there, I think, there's a few basic steps before that are often not fully explored. And I think that's where we're getting into what I would consider a really important piece for our population in TESFA and beyond, is really around questions of relationship quality, around couple communication, around negotiation skills, how those negotiations happen, what are the drivers of change at the couple or household level, how can you shift those, how can you measure that? So I think some of that is in refined questions around decision making, coupled with much better information around the actual characteristics of the relationships that they have. Are they talking to their husband about concerns they have? Are they being included in conversations around household decisions, or decisions about their health, or decisions about the health care of their children? All those questions are really critical to understanding how gender inequality in a real way is influencing their everyday lives. So expanding beyond the typical set of questions and developing more nuanced and more informative pieces of work is really critical. And I think there actually is a good example of why it's important to think about things in a mixed method context. I'm a quantitative researcher. I'm a demographer. I mean, demographers work with numbers. I love my quantitative side of things, but it's very limited in some aspects, and we just have to acknowledge that. And so the qualitative side allows you to explore those nuances in other ways that I think is very informative. And so the other piece I would say is, to get at some of these, you need a mixed method approach.
Well, you actually lead to my next question quite nicely, in recognizing that TESFA took an approach called Photovoice and actually had youth taking photographs of issues that were important to them. And I'm wondering what was gained from that, and what would have been lost had you not employed such an interactive method.
So for those of you who are familiar with Photovoice, at the time that we did it, it was more innovative than it is now. I think there's a lot of organizations using Photovoice very effectively and in quite interesting ways right now. But essentially it involves going into a community, selecting a group of participants in your program, training them on a basic approach to answering a question, and giving them photos, like cameras, to go and take pictures that may address that question. And then they come back and you debrief with them, and they pick the pictures that they felt best represented the issue. For us, we were asking them, how did this program affect your life most directly? And so what I liked about the approach was it's very much driven by participants. And so the youth take this. They have pretty minimal guidance. They go out there, they take the pictures that they would like, and they come back and they tell you what was really important to them. So it's not like a even qualitative structured guide. They go out there and they come back and you deal with what you have there. And so you have a very participatory approach that I think would have been lost otherwise.
Rosalind, welcome. Rosalind Mungo has joined us as a researcher from Restless Development's youth think tank, and she is in her second year of law school at the University of Nairobi and serving as a Yali Fellow. She also is quite busy doing a few other things. She's the founder of Book a Child initiative with a literature foundation and is a research coordinator for the Student Association of Legal Aid and Research. So your work with Restless Development and the Youth Think Tank aims to empower young people to achieve a greater voice in research and evaluation. Could you tell me a little bit more about that work?
Yeah, and it actually builds on to what Jeff was saying. The youth-led research methodology actually looks into involving the young people as the researchers. So you take the young people from an end-to-end process of the whole research project. And in this case, it's a joint partnership between Restless Development and the MasterCard Foundation. And we have 6 standardized steps in which the young researchers are taken from 7 different countries in Africa. We have Kenya, Uganda, Tanzania, Rwanda, Malawi, Zambia, and Ghana. And what happens is that we have young people participating from the first step, which is designing the framework. In this step, we have the staff role come up with a research purpose in which the whole research will be founded on. In this case, in our research, which I took part in, we had 2 sectors. We have the engagement of young people in the agricultural sector, and then we had them also looking into the hospitality and tourism sector. Now, what we have is a mixed method where the staff kind of find out the purpose, then the researchers give the feedback to the purpose. Is it something that young people are involved in? Because the whole essence of the research is to ground a youth perspective about young people. Then we move on to the second step, which is designing the questions. And here the young researchers take a lead role in coming up with the primary and secondary questions in which they will ask the respondents. And in all of the 6 steps, the young researchers take the lead role. They are the ones who are stating what is going to be done, what are the questions to be designed. Then we have them collecting the data, which is common to all organizations, where they undertake interviews, focus group discussions. Then we have them analyzing the findings. In this step, we have the staff taking a lead role in trying to come up with the codes. Then the researchers come up with the themes and also the main findings that come out from the reports that they had from the data collection. Then we also conduct validation. And in this case, the researchers go back to the community and present the findings that they come up with. Then the community try to elaborate and try to critique. Is it as it has been presented in the report, or is there a slight change? And to give an example, with the current report that we had, our main focus was on the use of agricultural innovations and technology. And one of the findings that we had was that the technologies exist, but the channels of getting those technologies was the issues. And we kind of found out from the community that there was limited information through inappropriate channels. And with this, it kind of brought about the aspect of it's not only the use of social media or the use of television sets that bring about this knowledge to the community, but what we need is an integrated approach, and that is why we conduct validation in essence. And then from the validation, we have sharing and catalyzing discussions on the research findings. And the essence of a youth-led research is that you're trying to illuminate young people, but using a young person's voice. And the essence of it is that you're able to capture the youthful perspective in a very unique way, because you're able to capture a young person's voice to the research in essence. And also, we do not use dissemination as a point in time, because we have found that dissemination is unidirectional in nature. So catalyzing and sharing discussions about the findings kind of brings about a multi-sectoral kind of perspective. And I was actually excited when Jeff mentioned on a mixed method approach, because in the youth-led research, we basically focus on qualitative data. And we kind of focus it because we want to know, what does it mean for the community? What does it mean for young people who are engaged in those sectors? And we use both of the two sectors in trying to understand and trying to analyze the findings so that whatever it is that you're going to bring about and whatever it is you're going to talk about actually does have meaning for the community and does have meaning for the young people.
I'm excited to have an opportunity to hear a little bit more about the approach that you all take. And one of the questions I have is, what do you see as the added value of engaging youth as full partners? And give us some examples of what is really being leveraged in this process.
The aspect of having a youthful voice talking about young people is an added perspective because it brings about finer issues that might have been overlooked if the research hadn't been looked at that perspective. And a final example is mostly about the findings. We found out that there are various innovations and technologies that are out there. We have mobile applications, we have mechanized forms of technology, but the main issue with young people is how basically are they uptaking them? What are the forms of information channels that they're access to? What are the financial products that are actually easier for them, that spread the risk in them uptaking these innovations? So with having a youth-led research, it brings about a unique perspective because it brings an added voice of a sidelined section of the community. And the beauty about it is that you're able to understand youthful issues from a young person's perspective. So you don't have to worry about, okay, so what does it mean for young people? Because a young person has already looked into it and has brought about that aspect of what exactly it means for young people. And another wonderful example is on the fact of when you do have a young person doing this, and we found it about in our research, is that one of the major findings that was brought about was on the case of gender, where we found out that as much as we are saying that we should open up opportunities for young women and we should open up opportunities for them in on-farm activities, there is actually a potential and there is actually a ready market for them in off-farm opportunities, because the society has already decided that women are better placed in off-farm activities. So we found out that even when we talk to young women, they know that off-farm activities are there and they know that that is where the potential lies. So even as they look for financial products and even as they look for opportunities to actually earn income, the best way for them to go to is on the off-farm activities. So it just opens up a new perspective that would have been skipped or overlooked by other programs and policies.
Thank you. It's helpful reflections. And one of the things that we've been grappling with is around the challenges side of engaging youth. What kinds of collaborations have not been as successful? Could you give us a couple examples there?
When we were starting, I think, this session, an amazing aspect that was brought about was the fact of engaging young people as partners and not as beneficiaries. And in most programs that deal with data collection and that deal with research, you will find that young people will be engaged in collecting the data. And the aspect of it is that when you tell a young person, I've never once been involved in collecting data, where I was just told, these are the respondents, just go ask them these questions, then bring them back to them, is that there's no investment in the project. That is, I will only collect what will be told to me, and I will overlook any other thing. But when you bring about these young people from the start of the project, you actually bring purpose and investment into that project, and they own the project. In that, once they go and they take them from an end-to-end kind of perspective, is that the young person tends to bring about the finer issues. They integrate each and every single issue that they might have overlooked if basically they were research assistants or they were basic data collectors. And that is the collaboration that I think needs to be refined, because it's not enough for young people to collect data. Tell them why is it important for them to collect that data. Tell them why is it important that they should actually invest themselves in this kind of issues. Because in our report, we found out that these young people have the answers to most of these issues that we are grappling with. When we are talking about uptake of innovations, we have innovators that are trying to solve some of the issues that we are looking into. If it is finding finance, we have innovations that are actually trying to bring about the end user in this kind of settings. So involve them from the word go and set the aspect that you're not seeing them as basic assistants, but they are actually partners. And with that goal in mind, once they go into the society, they will look as the society as they want to be the change in that society. I was actually very excited about doing agricultural innovations and technology, because from the word go, when we were designing the questions, there are certain issues that I also wanted to voice out. Like, let's ask these questions. Let us not ask these questions. Let's try to find out what this means to these people. Because in that aspect, I have invested, and I will know basically, like, as a young person in Kenya, what do other young people in Kenya face?
Great, thank you. Just to circle back to then some of the work that we've been doing, I'm wondering if Jacinta could actually provide a little bit of just 2 takeaways about the systematic review and the toolkit that might still encourage you to pick these up on your way out.
One of the major themes throughout this conference has been about the importance of working across sectors and working in collaboration to deliberately target PYD outcomes so that you have a larger impact on multiple outcomes. And so that is a major takeaway from the systematic review. We need more evidence. We need value for our money. PYD can provide us with that. And I think the last key takeaway is really building on what Rosalind and what our dynamic youth engagement panel said today, that they are key to youth-focused programming. It should be for youth, by youth. And I think our youth today have provided a variety of strategies for us on how we can meaningfully engage youth, whether it's through youth-led approaches, whether it's through having a youth advisory board, employing youth. They have ideas. We saw that today. I mean, our youth have been dynamic. I mean, wow. And they've really shown what they can contribute to youth-focused programming. And so that is one of the key takeaways that was from the systematic review and what we've seen today.
Great. Now I want to open the floor to you all to have a few questions. And so there's a couple mic runners around. And what I'd like to ask is just that you state your name and your organization and who you're directing your question to, and make it a quick question because we would like the opportunity to hear a few different voices. So who would like to go first? Back over there.
Thanks so much for your time and your presentation. Sarah Danish with Creative Associates. Work on a program in the Eastern Southern Caribbean. It happens to be a youth power program. Looking for all of you to provide any insights on successes and challenges with randomized controlled trials. That's my question.
And we'll do another question as well. That's a big one. Any back there?
Hi, my name is Nikit from Save the Children. I think my question goes to Chasina and Sujeta maybe about self-report bias in PYD measurement, and how do you deal with it and how do you account for it, if there are any statistical methods you've used to account for it in your work?
Ooh, another good question. All right. Maybe we'll start with that one because then we can sort of focus to the broader. So self-reported bias in PYD measures. It's something I know we grappled with in the toolkit, so would love to hear your thoughts on that.
Well, one way in the work that I've done is you pretty much use a variety of measures that are reported by multiple people. So I've done a lot of family-based work, and so to counter some of the bias that you might see from Adolescent Report, I've also collected data from parents and teachers as well, and triangulated that data to see if it's actually consistent.
I guess my approach to this extent I have one is when I know that a response is subjective and dependent on education and stuff, I try to check it against something that is more behavioral, observable, and see if it goes in the right direction. Some of those could be at a level higher than the individual. So for instance, if I know that there are clear distinctions between two districts, I look at the self-reports to see if those are consistent. So again, sort of another form of triangulation, maybe looking at higher level measures, not at the individual level.
Actually, I'll let you take your other mic, but Sajida, while you keep the mic, thinking about the successes and challenges around designing a randomized control trial, particularly, I'm going to add a little element to your question, thinking about these more holistic programs that can be challenging sometimes.
So we're involved in a 5-country study now where we tried really hard to convince our implementing partners to implement some kind of a design and to think about what questions we wanted to specifically address in light of what is not known in the field. So the first and biggest, and I think the most profound hurdle is convincing program partners of the value of what you're going to learn. And I think the way to do that is to be upfront and very articulate in saying most randomized control trials, unless you have a few $100 million, are going to answer very specific questions. So you better have a good sell in terms of what that question is and be clear, and then be very check to see whether that is indeed something that people want to hear about. So I think be humble and upfront about the limits of what the RCT is going to tell you, and then convince yourself and others of how that advances the frontiers of science.
I would just add that the complexity and the discipline that you need to implement that very successfully are really legitimate challenges that need to be thought very carefully about, particularly as we increase complexity of multiple arms with different components and thinking through those things. And I think I absolutely agree that if you don't have an implementation approach that is fully bought into the RCT, then you're likely to run into a great deal of problems. And that means from a research side, being very aware of and sympathetic to some of the practical challenges that they will face, and in some cases, essentially, if you want, ethical concerns that people have over the RCT type approach. And I think there are different cultures on the implementation front than there are on the research front, and concerns over not providing recipients or beneficiaries with the absolute best product all the time in the eyes of the implementation partner. And we all just have to be very aware that that's a legitimate concern that we should think carefully about before diving into it. It's part of the buy-in process, I think. It's very critical.
On the self-reported bias, when we are being kind of trained on the data collection, we usually have a capacity building session, and in which basically we're usually told on the subjective responses to the objective responses. And also we have now the aspect of when we are conducting validation. As much as we go back to the community, we also talk to other key stakeholders who are basically invested in that sector. In terms of agriculture, we usually talk now to government officials, society organizations, and also we talk to organizations like CSOs and CBOs that work within that area, just to give a clear picture on either to build on what the respondents stated or to also kind of give their own perspective on that so that in the end of it all we have like a multi-sectoral view of what the respondents stated.
All right, some other questions. Take two more. Mike's coming.
I'm Catherine Honeyman from World Learning. I'd like to hear about the prospects for this type of youth-led research for deciding what is requested in an RFA or RFP. So not waiting until it's been awarded, but engaging in this kind of research beforehand.
Interesting. All right, and another one? Over here.
Manol Yatani from American Institute for Research. Listening to a lot of program implementation and research, how it influences policymaking and the decision making at the government level.
And who's that directed to?
I guess in general.
Anyone? Okay. Well, who wants to take that one first?
I think ICRW is an interesting example of this because we very much view ourselves as standing between those two worlds of taking research and applying the learnings from that to policy or programmatic learnings. And I think if you have a very purposeful idea of what you would like to do with your findings and an advocacy plan and have a realistic goal for what you might be able to achieve with that, then that's step one. But it also depends very much on the suitability of the question that you're asking, the types of, is this something that can be readily adapted to a policy, or are you exploring a question around drivers? They're not all the same things. And so I think being very strategic in your thinking about what type of advocacy and dissemination activities you would like to do and who your target audience really is for that is really a critical piece. But we should all be trying to change the world with our research one way or the other.
And then thinking about the youth-led research at the proposal development stage, who would like to take that question on? Rosalind?
To answer, I'll just mix both of your two questions. And the youth-led research, the main prospect is that it can be developed in three aspects. The first, it can be a key contextual insight. At the beginning, when you're designing a program and you're trying to see basically how does this fit into the community, it can actually help you to understand what various aspects and issues actually mean to that community. Because basically we try to understand what are the experiences, why is it relevant to that community. And in terms of policies, and influencing key decision makers is that it complements evaluation. At one aspect, it complements evaluation in that it kind of describes on how a program has influenced or has impacted the lives of various young people or various people in the society, because you are using the researchers as your key into understanding how the society is working. And also it influences key decision makers. In terms of our research is that at the end of it all, we are going to catalyze discussions with various stakeholders. We'll bring about the public sector, private sector, organizations, academia, and also the society in trying to find out what are the solutions in which we can try to bring about in solving the issue of youth engagement in the agricultural sector. So it's very diverse, and it can be a key development issues, especially in civic issues.
All right. Well, I think our time is up, and it went really fast. And I want to thank each of you for joining us today and sharing your insights. Next up is going to be lunch, but I need to put on my MC hat, so I'm going to stand up and bring you back over here. So I have a few announcements before we go into lunch. The first half of lunch, we're actually going to stream a couple videos in silent mode, so you'll be able to eat in here, but from two of our grantees that were awarded through our youth engagement community of practice. And they had developed, we had awarded 3 different grants under the COP with the goal of deepening our understanding of youth engagement and what is the impact and the outcomes of engaging youth. So the first set is from Como Learning Centers, and they are based in Uganda, and Matt French here is the executive director, which I don't see Matt at the moment. Ah, there he is, way back in the back. And so this is part of the Como Learning Center's youth-led club documentary. We've kind of referred to it almost as like the year in the life of a club, but there is some very topically focused videos that you'll have an opportunity to stream here, and really is a teaser for joining in a conversation and discussing a bit more behind the scenes of the video with Matt during some of the breakout sessions. The other series that we're going to show during the lunch break, and again in just the first half of it, is from Restless Development. And they're really highlighting young people's role in PYD programs through their video series. And so several colleagues are here from Restless Development, and we'll be able to speak with you during the second half of the roundtable part in a breakout room outside. So those are sort of teasers to come. The one announcement we wanted to make was around our grants under contract from our Gender and Positive Youth Development Community of Practice. We have sort of just finalized the awards with 2 organizations. One is with Waves for Change, a local organization in South Africa, and the other one is with Mercy Corps. Both of them are taking different approaches to really understanding some gender issues in thinking around youth development. Waves for Change program is called Moving Beyond Data Disaggregation, Utilizing Evaluation Systems to Promote Gender Equality in Sports Development. And if Waves for Change give you any idea, it's actually a surfing sport and really looking at women's empowerment through sports that have a higher risk-taking element to it. And then Mercy Corps is based in Jordan for this particular initiative, and it's Girls Research and Learning Power, so Girl Power. And they're really looking at the engagement of youth researchers, similar to what Rosalind spoke about, and that process of empowerment for them. So we are basically in the equivalent of BAFO for the Youth, Peace, and Security grants under contract, so stay tuned. The second half of lunch, you'll have an opportunity to talk to some of the poster experts and specialists associated with them. So you're welcome to chat with them as part of your lunch. I'm going to mention the Usaid survey again, and for those of you that might be leaving around lunchtime, I know a couple of you had mentioned to me that you would need to go at this point. If you could fill out your survey about this event itself. We really do take these seriously. Our bigger room is part of it. How we structured 2 lunch lines, part of it. And so helping us to do better next year when we resume for what will be our 4th annual meeting. So now for lunch. You'll find it in the atrium. It's a buffet lunch. You will return to this room to eat. So we actually aren't eating in the atrium. Join your colleagues for some conversation. Enjoy the sort of silent video watching. Enjoy talking to some of the different specialists around the posters and work that they want to engage in. Pick up some materials, catch up on some other things. Do what you need to do during lunch. We will resume at 1:15 for our 75 minutes, 11 lightning talks. So enjoy, and thank you.